Limiting your calories for 5 days a month could cut your risk of cancer, heart disease and diabetes.
Fasting for 5 days a month could cut your risk of heart disease, diabetes and cancer, a study claims. Researchers at UCLA's Longevity Institute got groups of people to limit their calorie intake for 1 working week, every month for 3 months. The diet, designed to mimic the results of a water-only fast, allowed for participants to consume between 750 and 1,100 calories per day. By the end of the trial, those who followed the fasting-mimicking diet had lower blood pressure, more stable blood sugar, and better cholesterol levels than those who did not. This study provides evidence that people can experience significant health benefits through a periodic, fasting-mimicking diet that is designed to act on the aging process, said Dr. Walter Longo. Prior studies have indicated a range of health benefits in mice, but this is the first randomized clinical trial with enough participants to demonstrate that the diet is feasible, effective and safe for humans. Dr. Longo, along with Dr. Minway and colleagues, tested the effects of the fasting-mimicking diet on various risk factors for diabetes, heart disease, cancer or other conditions. 100 people participated in the trial from April 2013 to July 2015. The participants, aged between 20 and 70 years old and all generally healthy, were divided into 2 groups. The first group, the control group, was told to continue their normal eating habits for 3 months. People in the second group were placed on a 3-month test of the fasting-mimicking diet, with food supplied by the nutrition company L-Nutra during the fasting periods. The meals for the fast-mimicking diet contained precise proportions of proteins, fats and carbohydrates. After 3 months, participants in the control group were moved on to the special diet. The researchers found that participants on the fasting-mimicking diet lost an average of about 6 pounds. Their waistlines shrank by up to 2 inches. Their systolic blood pressure, which was in the normal range when the study began, dropped by 4.5 mm of mercury, while their diastolic blood pressure dropped by 3.1 mm of mercury. Meanwhile, they appeared to have a lower cancer risk, since most of them experienced a drop in their levels of IGF-1. Side effects were mild, including fatigue, weakness and headaches. Way and Longo said that while the great majority of participants had 1 or more risk factors for diseases such as diabetes, heart disease or cancer, FDA trials will be necessary to demonstrate whether periodic FMD is effective in disease prevention and treatment. Dr. Joseph Antoon, CEO of L-Nutra, Incorporated, which produces FMD, told Reuters Health that FMD is intended for use by individuals who want to optimize their health and well-being, by overweight or obese individuals who want to manage their weight in an easy and healthy way, and by people who have abnormal levels of biomarkers for aging and age-related conditions. That said, Antoon acknowledged that if you have common conditions associated with overweight and obesity, such as diabetes, cardiovascular disease and cancer, you should not use FMD without a doctor's approval. The product also should not be used by children under 18 or pregnant or nursing women. And it's not for you if you have certain metabolic diseases, liver or kidney disorders that may be affected by the very low glucose and protein content of the diet, or if you have nut or soy allergies. What's more, it should never be combined with glucose-lowering drugs, such as metformin or insulin, according to Antoon. Registered dietitian Ashley Brown of The Ohio State University Wexner Medical Center in Columbus pointed out that researchers compared the fasting-mimicking diet to participants' usual diet. Therefore, we don't yet know how this diet stands up against long-standing approaches already shown to be beneficial, such as the Mediterranean or DASH diet. It's not clear if FMD enables individuals to consistently meet all micronutrient requirements, she told Reuters Health. It's also not known how this type of restrictive diet affects muscle mass in the long term, and what impact this has on various indicators of health. Although there is some evidence showing these type of restrictive diets can help jumpstart people considering lifestyle changes, more research is definitely needed before this is recommended for individuals, Brown concluded.